Time now for the live coronavirus update for the city of San Antonio and Bexar County.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolf and our Director of Metro Health, Dr. Don Emmerich, and this is our COVID-19 update for the San Antonio community. Do want to note also that we have Dr. Kurian, Dr. Anita Kurian, as well as Dr. Jinda Wu here with us in the audience. Tonight, we are reporting a fairly alarming rate of incline in our case rate here. We have 436 new cases of COVID-19 tonight. That brings us to 4,873 cases in Bexar County. This is the biggest single-day increase of reported new cases. We don't use the state's reopening plan as an excuse to throw out the good habits we've been practicing to contain the spread. The virus is still out there. We need everyone to keep their physical distance. Don't host large gatherings. Wear a mask if you're within 6 feet of someone not in your household. Let's all do our part. I do want to go through the hospital numbers as well, because as we've been telling you from this very start, it's not just about the case rate, it's also about the impact to hospitals. And so we are seeing a trend there that we don't like. And today we have a total of 212 patients in the hospital. Of those, 82 are in the ICU and 41 are on ventilators. Here's another big takeaway from hospital data. A review of the data in hospitalization status and time period before the 25th of May and after the 25th of May reveals the following. Prior to May 25th, the average age of cases was 43 and a half years. Since May 25th, that has changed. It's decreased significantly to just over 35 years of age. The average age of those who were hospitalized prior to May 25th was 55 and a half years old. And since May 25th, it has declined significantly to just about 48 years old. Some testing criteria and methodologies have changed over time, and this may contribute to the change in age of individuals not hospitalized. However, it should not affect those who are in the hospital. The hospital system capacity does remain stable, though, and that is a good thing. But we need to make sure everyone understands the virus is out there. We're not done fighting this virus, and this virus is not done going through our communities, so we need everyone to do their part, slow the spread of this virus. We can contain this if we remain vigilant in what we have been talking about from the very start and the guidance from our public health professionals. I'm going to talk about the progress and warning indicators as we do every week, but first I'm going to toss it to Judge Wolf.
Yeah, thanks, Mayor, and thanks for reminding everybody what they should be doing. We are in probably the worst crisis we've had, but it is by far the worst crisis we've had since this started. The mayor gave you some numbers on what people are in the hospital today, but just to kind of relate that to just say 15, 16 days ago, on June the 1st, we only had 93 people in the hospital, 212 now. We only had 39 in ICU at that time. Now we got 82. And we had 20 on ventilators, and now we have 41. I think Dawn is saying that we're doubling in a 20-day period of time now. Just take those numbers and double it again in 20 more days. If we don't do something to cure this, we're going to be in a lot of trouble. And it was pretty clear what the mayor is saying. It's not rocket science. It's amazing to me that more people aren't doing this, and that's, the things we talk about over and over. The face covering, the 6-foot distancing, sanitizing everything. If we would just start doing that and everybody would do it, I think we'd get our way through this. We know we got to work. We know that we only can consume what we produce jointly, and when you're not producing anything, that means everything goes to heck. So we've got to work, but we've got to start working a lot more smart than we are. Now, to give you an example of why this is spreading, and if you take the nursing homes, which right now we're doing very, very well good on it, not a big spread or anything. You take the jail, we're down to only 30 people now that have got positive. And so both of those are stable populations. It's those of us that are moving around that are not taking the precautions that are spreading it. And it may be young people. The governor today made a lot of remarks. Well, it's young people that are violating this. Well, what happens, the young people violate it, then they can transfer it to somebody else that may have an underlying health problem or be elderly, and that person ends up in the hospital, and that person may end up passing away. So it's a dangerous situation, and we just got to be a lot more responsible if we're going to get through this.
Thank you, Judge. And the governor did refer to enforcement and potential strict enforcement on establishments. And what we can do to ensure that we continue to open up the economy and enjoy life here in San Antonio is all do our part. The simple things, the hygiene, sanitation, wearing a face mask, physical distancing. We can continue to open up if everyone does their part and does as the health professionals guide us. Now, I do want to spend some time going into the indicators now. As we mentioned last week, a team of health professionals is closely watching a series of progress and warning indicators that you can track at home at covid19.sanantonio.gov to give you a sense of how we're doing overall in the battle against this pandemic. So let's go through those now. Progress indicator number 1 is the number of COVID-19 cases by symptom onset date, and that, as you see, shows a notable rise in the number of daily cases. Let me explain this graphic for a second. You'll notice how it does not show the current spike in cases that we've reported just today. The reason for that is that the data on this graphic lags by 5 days. Remember, this is plotted by symptom onset date, not the date that we report the cases to you, which, ebb and flow depending on the lab. But even so, this graph still shows that we are currently not close to in any way meeting our target of a sustained decline in cases over a 14-day period. And unfortunately, we instead are seeing a sustained increase in cases over the last couple of weeks. Let me go to progress indicator number 2. This is our testing capacity, which does remain in good shape. We continue to have testing capability well above our goal, which was set at 3,000 tests per day. With the rising case numbers, we've obviously seen an increase in demand for testing, and so we want to remind you, if you're having trouble booking an appointment, to go ahead and call, or you can go to the website covid19.sanantonio.gov. You can also get options by going to 311 and selecting option 8, calling 311 and selecting option 8. Labs are operating with necessary supplies and personnel in place, but the increase in testing demand sometimes does cause delays at the lab level. Let me go to progress indicator number 3. This is our case and contact tracing capacity. Before I go through this one, I need to say we need your help. There is a sizable portion of cases and contacts that our public health professionals have not been able to verify simply because we're not getting callbacks. The public's response to our public health staff is absolutely vital in our efforts to contain this virus. So if you've tested positive for COVID-19 and a contact tracer calls you, please answer. You can expect a call if you are positive from a number that begins.
That briefing is continuing right now at KENS5.com and our Facebook page. And tonight we're learning an alarming case rise here in San Antonio. 436 new cases reported tonight. We're seeing an impact on hospitals. 212 people in hospitals, 82 of them in the ICU, 41 on ventilators, and an increase in young people getting the coronavirus. We're certainly going to continue to bring you more information on this story. We'll be right back.